Good morning and welcome here. We are live on April 12th, 2022. We're at Wesley Woodlawn Hospital and ER in Wichita, Kansas this morning. Thank you for joining us here. We're part of HCA and in the Continental Division, giving you an opportunity to learn a little bit more about healthcare careers. Specifically this morning, we are talking medical technicians. I'm joined this morning by Sonia Litsky, Emily Farron, and Wendy Crow. They'll introduce themselves here in a moment, but before I get to them, I want to give a couple of announcements. So at the very end of this, your teacher will give you an evaluation. We ask you that you please fill that out and give us feedback. We're here to help you. We are not going to do a virtual Q&A in May. Last year it was difficult with finals, so we're just going to skip it and not do that. Instead, we're going to do a hiring fair. We're aiming to do two of them, one on April 27th, it's a Wednesday, and another one on May 11th, it's a Wednesday. And this is specifically for high school seniors graduating this year who want to come and work at Wesley, who are going to go to school locally and intend to work longer than just the summer. So I will get out some more information here in the coming days, allow you and give you I'll give your teachers a link for you to go and sign up to participate in the hiring fair. Hopefully, I've worked with some of the teachers and they've said that they can get excused absences for their seniors to come and participate. Our goal is to do this either before finals for you or after finals, but before you graduate, and hopefully get you lined up for a job if you want it in the medical field. So we can't guarantee you a job, but we want to give you the opportunity to come and apply and go through that process and potentially have a job waiting for you by the time you graduate and as you go to school. So we will go ahead and we'll get started. So again, ladies, go ahead, take it away. Sonia, if you want to start by introducing yourself, and then Emily and Wendy, and we'll get going. We also have the video we'll show you here in a bit of the different, some of the different equipment here at Wesley Woodlawn for the lab, and we'll even take some of your live questions later. But for now, ladies, take it away.
My name is Sonia. I've been a med tech for about 11 years now. I've spent 10 of those here at Wesley, specifically at Woodlawn. I guess my specialty is chemistry. That's the department I work most with.
Hi, I'm Emily Farron. I have been a medical technologist for just over 9 years now. The last 3 here in Wesley, the previous 6 before that in Kansas City. I am the lab manager here at the Woodlawn campus, so I oversee both the medical technologist as well as the phlebotomy staff here.
Hi, I'm Wendy Crow. I'm actually the blood bank critical care manager at the Wesley main campus. I've been a med tech for 42 years, so I've kind of seen the whole gamut of what's happened in the med tech world.
Well, Sonia, do you want to talk about what is a medical technologist and
Yeah.
kind of what we do?
So I guess the easiest way is, whenever you go to a doctor's office or if someone's in a hospital and they say we need to run tests so we can see. A lot of people don't realize who does that. That's us. So we are the ones who actually run those tests to give the physicians those answers so that they can start treating patients.
And I think 70% of what the laboratory reports out plays an important part in the diagnosis of whatever's going on with that patient. So we do perform a very important role.
We also have a mix of both analyzers that perform a lot of testing for us, as well as manual testing that we do. We have, especially in our hematology departments, we have slide reviews where technologists that are trained go in and look at the specific types of cells that are present in your body and can kind of help the doctor diagnose different conditions based off of the cells that they find.
So Wendy, you've been doing this for a while. So what is it about being a med tech that makes you want to keep doing it?
I think for me is I want to make a difference in somebody's life. And I don't want to be the kind of person that has to touch the patient. I'm more in the background, but what I do every day is I feel like I'm intervening on behalf of a patient because I really do desire to make a difference in a positive manner for that patient.
Sonia, how did you learn about being a med tech?
So I actually started school pre-dental and got a couple years into college and realized that much people contact is not for me. At the time, I was a TA for my micro class, and my professor was also my advisor. And she said, "Well, why don't you do micro professionally? Do it, clinically." And I didn't really ever think of that as an option. And so that's when I learned about the med tech program. And as I got into it, I realized that that was really a field that played to a lot of my strengths and allowed me to, like Wendy said, I get to help in the best capacity that I think I can.
I think one of the unknown things about the medical technology field is that there are sections to it. As Wendy said, she is the blood bank critical care manager, so she deals with a lot of the blood bank and the blood transfusion types of things, whereas I am more the core lab manager for the Woodlawn campus, so I take care of chemistry type of testing and our hematology testing. We also have another manager who's over our microbiology department, so her and her techs specialize in the microbiology aspect of our job.
So with that said, there's just a lot of variety in the med tech world. So if you get into the program and you find out, well, maybe hematology isn't really what I like. I mean, there's just so much more when you think about chemistry, blood bank, micro. It's just, it's amazing how you can branch out.
What type of person would succeed in this? I mean, interests and that kind of thing. Go ahead and answer that.
Would you answer that, Sonia?
Go ahead and answer.
So, Sonia, why don't you tell us about the kind of people we are as med techs and what kind of things we focus on?
So obviously, most of us are very sciencey people, a lot of us tend to be a little more on the introverted side, but that doesn't mean, I'm a pretty talkative, I'll talk to anybody and make friends kind of person, but, we kind of work as a team. You also get to work alone. So you can get a lot of different personality types in this job and find the right fit for you. And I think that's what's really great about a med tech position is that you can find something that's a good fit for you.
I think one of the other good characteristics in our position and of most of us that succeed in our job is how detail oriented we get. Part of what we do is making sure that things run appropriately or that nothing gets missed as we go through steps. So that detail oriented is a big position there. Wendy, why don't you tell us how people become a medical technologist?
Well, there is a med tech program through WSU currently, and I believe that's a 4-year program.
Mm-hmm.
And then you get accepted into the program, and it's a year of clinicals where you actually do part of your clinicals at WSU, but then you get sent out to all the different hospitals. And so a student may come to Wesley and they would be doing their chemistry, their hematology, their blood bank, and they all have a rotation and it's several weeks long. But that kind of gives the student kind of an opportunity to see what they really like because it's very hands-on. And that way they can kind of determine, hey, I think I want to be a chemist or I think I want to be a hematologist. So it's just a great opportunity to see how the med tech world works.
And I think with the med tech world as well, you've got levels just like most people know nursing levels. You've got LPN, you've got RN, you've got BSN. The med tech world is very similar in that you have MLTs or medical laboratory technologists, which is a 2-year vocational type of degree. They go through a shorter program, kind of have a limitation on what they can do versus a medical technologist. So then your medical technologist is your 4-year degree. You have specialties such as blood bank, microchemistry, that you can get added on top of that and with some extra education and training. And then the new one is a master's of medical technology that just actually started rolling out last year. The closest school I know of for that is in Kansas City, but I have a couple friends in that program so far and they're really enjoying that. And then the molecular, Sonia, you know a little bit more about that than I do.
You can go and get a master's in more of like a molecular diagnostic type testing, which is more of like what looks like the super futuristic testing on the TV. A lot of that stuff they're doing now for real. I have a friend who lives in Florida that did that. She got her master's. And so when COVID stuff hit, she got to do a lot of really cool testing stuff to help set those platforms up. And it's just really cool to see science in action like that.
So what kind of hours do med techs work?
That's always a fun one. So we're like every other hospital. We're 24/7, 365. So somebody's got to be here on the weekends. Somebody's got to be here overnight. Most of us in our facility do 8-hour shifts. Several facilities do 12 hours, just like most nurses that you know. It's kind of what works for you and what's available at the time. Sonia, what do you think the hardest part of your job is?
Kind of like you were talking about being detail oriented is, making sure that, I want to do things quickly, but I also need to make sure that I'm keeping everything in mind, and just making sure that I'm communicating with everyone around me, what is going on, what needs to be done. But really just focusing on the details, because sometimes you want to get moving so fast that you kind of stop to slow down and do it right.
And I think one of the other interesting things about a medical technology role is we all kind of focus on hospital being a med tech, but there are lots of other roles out there to do that. We have medical techs who come in to help us set up new instrumentation, to get new testing platforms associated. Who work very closely with our vendors to make sure we have the right platforms, that we have the new technology at our hands in the hospital, to be able to perform our job and to add to that physician knowledge base that we try to have every day.
Well, and even the instructors at WSU, they're
Correct.
all medical technologists.
Correct.
So you could even teach if that's something that you'd be interested in. So what's the most rewarding part of your job?
I think the most rewarding part is, we don't get to see patient faces. A lot of it is we see a name, but, you get to talk to the nurses and things like that. And when you've had a patient that you've been working with the nursing team, working on labs, trying to figure things out, and then to get to hear that that patient is better, that they went home, it's really rewarding to know that part of what I did helped him go home.
I think one of my favorite stories over the last couple of years, and Wendy, you might have to fill in some details for me, but one of our hematologists in our Wesley Hillside lab had a specimen that came to them from an outlying facility. That patient had some very abnormal cells that told that medical technologist they needed to get a hold of somebody and get that patient back to our hospital. They unfortunately couldn't get a hold of the physician's office right away, so they worked with our pathology team and our medical director to make sure that that patient could get into our ER and be seen and be able to start treatment instead of waiting to get a hold of that physician's office because as they closed for the weekend.
And I truly believe that was a life and death situation. And that's the kind of thing that we get to be involved in. We do have a voice in people's care. I know a lot of times we, at least in the blood bank, will get orders for blood products that may not be really needed. But we have a medical director who will call a physician and say, hey, I really think this is really what you need instead of what you ordered. So it always feels good when you have a voice in patient care.
So Wendy, I know you got some cool stuff. What do you think is the coolest piece of equipment that you have?
Well, right now in blood bank, it would be our Lumina, which is an automated blood bank system. And that's probably the last thing in the entire laboratory that ever got automated. But it will do blood types, it will do antibody screens, it does antibody identification. It's kind of like having a person in an instrument. So it's just really a workhorse for us, but it's a great analyzer.
What about you, Sonia? What do you think is the coolest?
It's one of the more simple things that we have, but honestly, I think our CBC analyzer, because before that thing came along, people had to count these by hand. And I mean, you're sitting there counting hundreds of cells and you have to differentiate what's what. And now with this new analyzer, it can run it, it can read it.
And I'm just gonna interrupt
Yeah.
Sonia for a minute. There's a video on your screen. That is the hematology analyzer she was talking about, the one that just passed you by.
So it's a lot of technology in a small box.
So this is a video of our lab here at Wesley Woodlawn and just some of the equipment we work with every day. That's Matt. He's one of our med techs that actually just got accepted to PA school. So he's a fun one. We do a lot of microscopic work, a lot of manual work when it comes to our hematology. That is our wonderful urinalysis analyzer that we do all of our urine specimens on, which there are quite a few of those someday. Centrifugation is a very important piece to us. We have to separate out red cells from plasma, urine sediment from other parts of urine, just different pieces there depending on what testing we're looking for there. Manual pipetting is a big thing for us as well. Making dilutions for our chemistry testing or any of that there. All of our storage needs, we do a lot of storage in the lab and a lot of it comes with very specific requirements of how we keep it. So everybody has to make sure temperatures are within specific ranges. This is more Wendy's world. This is our little blood bank here at Woodlawn. We don't have quite the facility that Wendy has at Hillside, but we get to do a lot of the same testing there.
Well, and something that you touched on is that Matt just got accepted into PA school, but a lot of people use medtech as a springboard to other careers. I've had several medtechs that they've gone to be physicians, PAs. I have one that just went to the health department. She got her master's. So, I mean, there's a lot of opportunities to not only to start in this field, but to continue to grow if that's your desire.
It gives a great base knowledge of healthcare that sometimes, and it gives you a different way of looking at it that you don't always get. The lab world is one of those that has been very insulated. We're almost always behind a locked door because we have a lot of patient information that we can't let into the hands of the public. So it's not something you see every day. So it's a very interesting way to look at things that you don't always get.
So we know that sometimes our jobs can be stressful. How do you handle that stress?
Oh, I think the biggest one for me was learning that I can have hobbies again between school and me having to work full time. At the time, I didn't know what that was. So finding hobbies, I read a lot. You know, Sonia goes to the gym every morning, so we try to make sure she gets there several days a week. Just making sure you find that balance. Because healthcare is a tough world to be in, no matter which role you have.
And I think it's important at the end of the day, whatever your kind of unplug routine is, you know, sometimes it's just, I sit in the car for a couple minutes, just, okay. And then, you know, kind of go home and love on the dog a lot.
How about you guys? Do you have any questions for us live now that you've kind of heard a little bit about what we do?
She's probably asking so you can answer
Scott brought up a question of is there any jobs that you can kind of step up into med tech? So, well, you do have to have your degree and you have to take boards for it to actually do a med tech. There are a lot of jobs that can help get you kind of get your foot in the door, get an idea. The biggest one is phlebotomy. They work very closely with us. They are part of our lab team. They draw all of our blood. And this is a position that you can get into. It does not require certification.
It does not. So for a phlebotomy role, you just have to have your high school diploma. And then we recommend that you go through a phlebotomy training course, but it is not required. We can most of the time train you on site as well.
Well, some people will actually work as a phlebotomist while they're going to school during their med tech program.
That's actually how I got through med tech school. is working here in town at one of the hospitals as in a phlebotomy role. All right, Sonia, what about something you wish you would have known before getting into the med tech world?
Um, there was a lot that I didn't know when somebody told me, why don't you go do medical technology? At first I thought it was the people who worked on medical equipment. I was like, I can't fix anything. But, you know, I wish I would have known about what this position was a lot longer, because I kind of took an extended time to do the program because I started a different degree and finished that out before I started med tech. So I really wish that I would have known about it sooner. So that's something that I could have at least had on my radar, known about, and thought about as a career choice.
It is a well-kept secret.
It is.
Yeah, because when I graduated from college, I just knew I love biology. I love chemistry. What am I going to do with my life? And then somebody said, well, why don't you look into being a med tech? And once I landed there, I knew that was the perfect fit. I loved it.
I got lucky enough to be introduced to the medical technology role when I was still in high school myself. My mom worked for a clinic in my hometown and a while ago, so they still let me wander around back then, and I wandered into the lab, and they let me help them set up some microbiology testing and streaking plates and pipetting. It was a lot of fun, and I really enjoyed it from there.
So how competitive is it to get in and be in the program?
Do you know the answer to that, Wendy? Because I'm not really sure anymore.
I mean, I think they have a certain amount of slots.
Mm-hmm.
And once they fill those slots, then whoever applied would have to wait till the next class. And I think they do desire a certain GPA. But other than that, I'm really not sure.
Let me switch that question a little bit and talk about the demand for medical technologists in the future. I know we have several openings right now, and it can be a position that is difficult to fill. So talk about job security and demand for it going forward as far as you know.
That's a better way to look at that question. So as you said, we have many open roles here. Medical technology is a field that we've got a lot of retirements coming our way in the near future all across the United States. You can find a job if you want to stay in Wichita. If you don't, there are jobs all across the country. A few states do require an extra licensure. While we all had to set for a registry exam, some states require an additional one, such as Florida, New York, Tennessee, a couple other ones that I'm forgetting at this point. But you can almost go just about anywhere and find a med tech job at this point in time.
Which didn't used to be the case, but nowadays, oh my goodness, the door is open.
Mm-hmm.
And it's not just hospitals. There's also physician offices and clinics that also have med techs.
Reference labs are a big one as well right now. They, span across the country and do a lot of really cool testing sometimes that specialize to certain areas of the country.
Even our local Red Cross,
Mm-hmm.
they have a reference lab, and they employ several medical technologists.
Have you guys learned anything from COVID? I mean, through your role specifically, but has COVID changed what you do or given you new insight? Or I think one of you talked about it at the beginning, playing a critical role, medical technologist in, I don't know if that was vaccine creation or just pathology of it, diagnosis.
Testing options.
So talk about COVID and your position and the different ways that it has impacted it and what we've all learned.
I think lab has a unique perspective into COVID practices. The lab always has kind of an above and beyond approach to protective health equipment because of the type of specimens that we get. So in COVID, you get a lot of respiratory type specimens, and we are taught to treat every specimen like you don't know what's in it. It could be the most infectious thing that you have ever seen. So in terms of that side of the world, the labs were more ready for it than anyone else. We handle a respiratory specimen in specific ways to make sure that does not expose ourselves so that we don't expose our families and do different things of that nature. So we had a unique perspective going in of that we kind of always handled things that you never know what you were going to get yourself into. So make sure to take those precautions from the beginning.
I think the other thing with COVID, we were involved, at least the blood bank was involved in actually the treatment of COVID patients when they actually came into the ER. So there was a new product that came out at the beginning of the COVID, and it was called convalescent plasma. And it was people that had already had the disease and they had antibodies in their system. So they would go to Red Cross and donate, and then we would use their plasma to treat patients that came into the ER. And that we did that for several months. It's kind of lost favor at the moment, but at the time, it was just, we loved being part of that, treating the patient with what was available at the time.
Any other questions?
Any other questions from you guys?
I don't think we do. I think you've answered everything that my students are. I have several students taking phlebotomy next year, so they were especially interested in that. That's kind of a stepping stone. So yeah, we really appreciate your time this morning.
Wonderful. Thank you guys very much for letting us come and talk to you.
Thank you.
All right, so yeah, thank you, Melody, for, you guys don't have to get off. But yeah, I think, just correct me if I'm wrong, ladies, but it sounds like the type of personality that would excel in this, someone that likes chemistry, because I know you like chemistry or biology, and there's some people that like both. Are you saying that this is good for someone who likes both?
Correct.
Okay.
Be a good fit.
A lot of people, if you want to help and have an impact on people, but don't want direct patient contact, a problem solver.
Yes, very much so.
Yes,
Oh.
critical thinking skills.
And critical thinking skills. So if that's you, get a degree. We'll have a job for you probably. So, yeah. All right. Just a reminder, please fill out the evaluation. Hopefully this is helpful to you. All you seniors out there, if you're interested in this, go ahead and write that on the hiring fair on April 27th or May 11th. Write it on your evaluation that you want to participate. I'll also get information out, but let us know if you want to, and we can reach out to you directly. If you're interested but not able to participate on those days, please write that down on your evaluation, and I can reach out to you directly and help facilitate an interview and an application process for you there. No virtual Q&A in May. Good luck on your finals coming up, and good luck these last couple of weeks of school. Do your homework, fill out your assignments. You're welcome, Mrs. Robinson, for that. All right, thank you very much for participating. Ladies, thank you. You guys did fantastic. And if you have any questions, feel free to reach out to me at any time. Thanks.
Thank you, guys. Thank you so much.
Thank you.
Bye.